So while we're stuck here in isolation, we're going to try to start putting together regular videos about employment-related issues that are coming up because of the COVID-19 pandemic. Right now, from the employee side, one huge issue we're seeing is healthcare workers' concerns about working when the best protective equipment may not be available or may not be being provided by the employer. Specifically, what we're seeing is questions about whether healthcare workers, such as nurses, must report to work when their employer is not providing equipment like N95 respirator masks. Like most employment questions relating to coronavirus, there are no easy answers. We'll first look at some legal considerations, and then we'll talk about some practical considerations. OSHA is the federal agency which regulates workplace health and safety. OSHA Regulation Section 13A allows employees to refuse to work when the employee believes that he or she is in imminent danger. To be considered an imminent danger, the workplace condition must reasonably be expected to cause death or serious harm immediately or before the imminence of such danger can be eliminated through OSHA enforcement procedures. In further defining imminent danger, the condition must be reasonably expected to shorten life or substantially reduce physical or mental efficiency. OSHA requires that 4 points be met before an employee can refuse to work. The employee must ask the employer to eliminate the danger, and the employer must have failed to do so. You must genuinely believe an imminent danger exists. A reasonable person would agree with you that there is a real danger of death or serious injury, and there isn't enough time to correct the danger through normal enforcement channels, such as an OSHA inspection. With COVID-19, the question will be whether employers have failed to eliminate the danger. The CDC has issued guidance that in the absence of N95s because of supply chain issues, surgical masks are acceptable. So if, for example, a hospital is simply not providing N95s because it thinks it's too expensive, the hospital may be failing to act to eliminate the danger. But if the hospital cannot provide N95s because of a real shortage, the CDC guidance suggests the hospital is, legally speaking, eliminating the danger by providing alternative safety measures which are available. In sum, if your healthcare facility is taking whatever precautions are available to it to mitigate your risk of exposure, I'd question whether you'd be able to establish that the employer has failed to eliminate the danger. In addition to OSHA rules, healthcare workers working without certain protective equipment may implicate pregnancy or disability discrimination laws. We're hearing from many nurses who are pregnant or who have recently given birth and are breastfeeding who are extremely anxious about exposure to COVID-19. Others have underlying medical conditions or family with medical conditions. We obviously understand employees' concerns about exposure. Under discrimination laws, employers are required to provide reasonable accommodations, and reasonableness varies by circumstance. If hospitals are providing as much protective equipment as is available, they are arguably providing reasonable accommodations. The practical consideration is that each worker has to think about what the right thing to do is for his or her own situation. Some workers understandably can't take the risk and may want to try to invoke the OSHA refuse to work rule. The risk is termination and a later determination by a judge that one or more of the 4 elements of Rule 13A were not met. In other words, the termination may be lawful. In sum, take all the information available to you and decide what's right for your particular situation. We know this is not the most comforting analysis. There is unfortunately little comforting news these days, and we're in some uncharted territory. Because every individual situation is different, we urge you to speak to us directly or to another lawyer before making a decision to refuse to work because of COVID-19. Regardless of your decision, we thank you for your service in this time of crisis.